The Link Worker Conference is the second conference put on for link workers who are the link between medical healthcare practitioners and public health, and they are there to operate social prescribing as part of healthcare interventions. This is my presentation, which introduces the idea that independent health stores can be the missing link for social prescribing. My name is Jennifer Carson and I'm the Technical Manager at Viridian Nutrition. As a food supplement company, we truly believe that link workers are a cornerstone linking medical healthcare and public health. And this is a forward-thinking and health-orientated opportunity which can embrace the independent health store in fulfilling population health. In this presentation, we'll have a look through an introduction to health food stores and their value to population health. We're going to have a look at the foundations and basics of nutrition and what the current situation is in the UK. In addition, we'll look at the role of the health store in the community and then conclude with, does the independent health store truly provide the missing link? To set the scene, we'll look at this video which is an introduction to how health food stores truly can support the work of medical practitioners within the communities of the UK.
The link between nutrition and our physical and mental health is of course very well known. And while the NHS offers guidelines on healthy eating, some are wondering why the focus on nutrition isn't as strong as it could be in GP surgeries.
GPs are under a lot of pressure at the moment and NHS funding has gone down remarkably. So I feel like we're practicing more reactive medicine than preventative medicine. You know, patients are coming in with a list of their problems because they've had to hold on to all of these issues as they haven't been able to get appointments, and we've got 10 minutes to try and attack each of these acute things. But it means that sadly we're no longer thinking about how can we prevent problems from happening, how can we educate, how can we promote health.
And frustratingly for GPs, the best advice often can't be handed out via a prescription.
Lifestyle medicine to me is about using interventions like physical exercise, diet, sleep management, stress management to reduce the risk of disease and to lessen the burden of an illness. Health food stores are a great resource to help with education, to help with lifestyle, and to help with kind of simple health and well-being tips. So I really think we need to start drawing on that expertise and not feeling like we have to be so protective over medicine.
And health food stores are a resource ready and waiting to be tapped into. With over 850 independent shops around the UK, like G Baldwin & Co in South London, staff are on hand to offer life-changing advice.
I would suggest GPs start to familiarise themselves with the local health food stores. You know, go there, have a chat to the people that work there, understand the training they've had, the protocols that they have to go through, the services that they can provide, so that actually the GP can then confidently suggest to their patient in that consultation that this is an appropriate place to go.
So what are the barriers to nutrition and what stops people from accessing good nutrient-dense foods? Well, there is an issue around access to food, and as demonstrated in the figure on the right hand side of the screen, this shows that the total household spend on processed foods in the UK is nearly 51%. Now these figures are from 2017 and they also include the spend on things such as household items, cleaning items, so that it's purely not just food. So we can see here that a lot of the UK are not investing in nutrient dense, good quality and potentially healthy foods. Now this can be down to budget, it can also be down to interest and level of knowledge around nutrition and what are the healthier options. But it's also highly impacted by the density of cheap processed foods that are available. In 2010, there was a campaign called Change for Life, which empowered community stores to stock fresh fruits and veggies. And this was shown that at the time did improve community choice in how they nourish themselves and their families. However, there are still areas of the UK where the most available cheap foods are potentially from fast food outlets. And then finally, we do have the issue of agricultural practices and poor soil mineralisation and poor soil replenishment, such as that done by soil erosion. Okay. So this is a really interesting observational project. Blue zones, if you've not come across it, you can Google it. There is a website. There's also a TED talk run by the chief researcher, Dan Bertner. But the Blue Zones project was an observational study that looked at the areas, which countries and which locations in each of those countries had the highest density of centenarians, and also looked at the lifestyle factors that were common between those locations. Now, the main common denominators were the individuals ate wisely. They were mainly plant-based, so 80% of their diet came from plant sources, and that remaining 20% came from good quality, either wild, free-range or organic animal produce. In terms of connection, there was a big sense of community and daily socialisation. There was the engagement in their community with other community members. And in addition, in terms of their attitude and outlook, there was definitely a movement away from stressful attitudes and stressful lifestyles. And in fact, there was a seeking to have a lifestyle that gave them purpose and hope. And if any of you have read Viktor Frankl's Man's Search for Meaning, you will see that that is a big theme throughout the book that potentially supported Viktor Frankl to survive his situation. In addition to that, any exercise was more a day-long exercise of low intensity. So there wasn't a specific hour of exercise at one point in the day. It was more that these individuals were moving and walking for most of the day. And a lot of that movement was done outdoors in nature. So where can we make the links between Blue Zones and the common denominators that contributed to this longevity and the independent health store? Well, the independent health store employs highly trained and highly qualified individuals, and therefore they can give excellent nutritional advice. There's also the HFI protocol, Health Food Institute, which signposts when a customer should be redirected back to their medical professional. In addition, there's a great range of produce, offering produce to match different budgets. There's the community feeling and that sense of engagement and being part of a movement, whether that's through the attendance of activities or educational events. And finally, there's the planetary health and looking for more eco and sustainable options within diet and lifestyle produce. Health Food Institute offers a protocol and guideline for independent health food stores to support the choices of their consumers. Now, the main triggers for referral back to their GP when selecting appropriate food supplements is the diagnosis of a chronic condition, the management of long-term health conditions, and also the prescription of medication. So this gives a complete professionalism and builds loyalty and trust with the community and the health food store consumers. So is the independent health store truly the missing link? Well, this is a social prescribing diagram taken from Public Health England. And what I've done is I've shown the different aspects of the provision of social prescribing that truly can be achieved within the health store setting. So we can see the provision of food, but not also the provision of food, but also the education in terms of preparation and cookery. So attending cookery workshops and cookery events, getting ideas of what to do with the produce that's been purchased. Also, joining a community, whether that's through activities or meeting people within the store that then, other activities are with. So maybe they go out on a bike ride or out on a walk. And there's also access to ancillary events such as art classes or meditation. So I think you'll truly agree with me that the independent health store can be a valuable asset and resource in the community to support link workers and their role in social prescription. Now, the easiest way to find your nearest independent retailer is to use the findahealthstore.com website, and here you can locate independent health food stores in the vicinity of either your home or your workplace.